welcome to Kinship Care Week. My name's Anne Tom and I'm a Kinship Care consultant for KCAS service, which stands for the Kinship Care Advice Service for Scotland. And I'm absolutely delighted today to introduce you to two researchers, Dr. Maggie Grant and Judy Warburton, who are going to give us a lovely presentation on FACE19, which is a research project that has just been concluded, so it's quite fresh, and it has involved a lot of kinship carers. So if you're joining us this morning and you're a kinship carer, thanks very much. But if you've participated within the study, if you've not and you're just wanting to know about research, that's fine as well. We have a Q&A down at the bottom. If you would like to ask any questions, please feel free. Please also feel free to put any comments in the chat and introduce yourself in the chat. Please feel free to do that just now if you would like to. During Kinship Care Week, we felt it was really important to have the voices of kinship carers throughout the week, and that's been a challenge having to do that online. So that's why we've done the webinars and focused on what kinship carers have been saying during the pandemic, positive things and negative things. So we want to hear from yourselves as well. So please comment, and also after the webinar there'll be a chance for a SurveyMonkey to let us know what you thought of the webinar as well. So without any further ado, I would like to pass you over to Maggie to start the presentation. Thank you.
Morning everyone. I think I can speak for Judy and myself when I say we're really delighted to be here today. We do wish that we were in a room with you all and could have, you know, a cup of tea and a biscuit together, as well as being able to talk about the research. But you know, these are the circumstances we find ourselves in, and we're really delighted to be able to talk to you online about this study. The reason it's called FACE19 is it was about families and children's experiences of COVID-19, and it was a project that was set up under a rapid research funding stream, so research that kind of was designed and developed during the kind of very initial stages of the pandemic. It was based at the University of Stirling and led by Judy and my colleague Jane Callahan. I should say it's not, we're at the point just now where we're yet to submit the final report to the Chief Scientist's Office, who were the funders for the research, but the study was designed as what they call a rapid research study to get findings out to people, you know, more quickly than a traditional research project, in order to be useful to people in the kind of fast changing and ongoing circumstances of the pandemic. So it was based at the University of Stirling, but with four kind of third sector partners to both to reach participants for the study, but also to involve organisations in kind of thinking through what were the kind of key questions and key findings that were coming through from people as we found ourselves in, you know, this situation of the pandemic and the related social and kind of health restrictions that we've all been experiencing for the past year. It's interesting actually presenting it now, because it is almost exactly a year since you know, life changed for all of us. Judy and I were part of a much larger research team. There was about 8 or 9 researchers involved in this study, and Judy and I had a particular focus on bringing in the experiences of kinship carers and key workers who support kinship carers to make sure, I suppose, that their experiences were represented as part of this larger group of children and families. So AFA Scotland, I've got a split role between AFA Scotland and the University of Stirling. And AFA Scotland was one of the 4 third sector partners. Judy, you can help me if I forget any of them, but there was also Scottish Women's Aid, Aberlour and Parenting Across Scotland, and then 1 or 2 others that kind of joined in as the study was progressing. It was funded by the Chief Scientist's Office, and as I say, it was part of this kind of group of studies or body of work that was commissioned in relation specifically to COVID-19. So what did we do for the research? We carried out interviews either online or by telephone, depending on what people felt most comfortable with. We talked to 30 parents and carers, 50 key workers. So we used the term key workers deliberately because we wanted to make sure that we could include a kind of wide variety of professionals that work with children and families. So from social workers to teachers to support workers to people working in a whole range of voluntary and statutory organisations. We also talked to 12 children and young people. Within that sample of interviews were 15 kinship carers, some of whom we spoke to twice, and 15 key workers who were involved in directly supporting kinship carers and the children in their care. We also did surveys which were completed by 480 parents and carers and 226 key workers. And we also ran a number of focus groups that were facilitated by the third sector partners, so to kind of test out some of the information as it was coming through and gauge their perspectives on how life had changed during the pandemic, how services had responded to that, what were the things people were struggling with, those kind of questions. I should emphasise what we're presenting today is preliminary analysis, but as I say, that was about making sure that we can get findings out to people, while things are developing, because the pandemic is far from over. I think when the project was first set up, it was envisaged that we would be kind of collecting data over the summer and towards the end of last year. And then by this point, we would probably almost be looking back on the pandemic. And as we know, we're in a new phase of the pandemic. Certainly things have changed, but we've still got some way to go before life looks like what it looked like before any of us had heard of COVID-19. So just to kind of step back before we talk about what we found in our study or what we've been finding, we chose to have a particular focus on kinship care, as I say, to make sure that was represented as part of the experiences of children and families in Scotland. And there were some, particular reasons for that. I've pulled some information together here there's a really good summary that Joan Hunt has done on the past 20 years of research on kinship care. I've included the reference to that at the end of the presentation, but it's a really useful piece of work for kind of pulling together what do we know from previous research that's been carried out around kinship care. We know that there are around 180,000 children in the UK, according to the 2011 census data anyway, although only a minority of those children would be kind of under formal care of local authorities. So we know in Scotland that there are a number of children placed with carers under a kinship care order, or who go on to have a kinship care order. But we also know that there are lots of children who are looked after by relatives, by family friends, without that kind of order. And for this study, we weren't just looking at children where there was a kinship care order in place. We were much more interested in the experience of children growing up with relatives or family friends. We used that kind of wider Scottish Government definition for kinship care. We know from previous research and from speaking to kinship carers, from speaking to social workers, that grandparents form the largest group among kinship carers, but obviously there are also other carers. There are siblings, there are other relatives, sometimes family friends, that step up when a child's unable to be cared for by their birth parents or unable to be cared for by their birth parents on a full-time basis. One of the things we know, and was abundantly clear in our own research as well, is that kinship carers are a really diverse group. They're diverse in terms of age, in terms of where they live, in terms of their financial circumstances, in terms of their relationship to the child. But as a group, we know that on average, they are more likely than other groups, such as foster carers, to be sole carers, to have more limited financial resources and overcrowded housing, and to have a disability or a chronic health condition. So just to re-emphasise, we know that this isn't something that applies to everybody, but if you took, say, 100 kinship carers and 100 foster carers, you'd be likely to find higher rates of these things among the group of kinship carers. And that's something that's kind of been demonstrated across the whole range of research studies across the UK and elsewhere, actually. We also know that in general there are very high levels of commitment to children, that kinship carers, this comes through again and again in research, they throw themselves into this role, and that commitment to these children and to giving them, well supported, loving childhoods comes through really strongly, and their commitment to children's well-being in a whole range of ways. But we also know that commitment is often in a context of high stress, and for carers. And we also know that kinship carers are less likely than foster carers or adoptive parents to have access to both formal and informal support. Again, that's something that varies hugely, but we'll come on and talk a bit about some of the kind of gaps around support for kinship carers that they talked about when we interviewed them. So I've talked about some of these things that kinship carers are more likely to experience, and I think one of the things that's noticeable is the overlap between those kind of factors and the heightened risks during the pandemic. So, we know that with COVID-19 there are heightened risks related to age, related to prior health conditions, kind of previous health experiences, and related to where people find themselves under financial strain, or are living in overcrowded housing. These are all things that increase people's risks during the pandemic, either the kind of direct health risks, but also the kind of broader risks around just life feeling really, really difficult during lockdowns and during this time of social restrictions. So what Judy and I did is, over the period of time that we were collecting data, we talked regularly about kind of what was coming through in these interviews, and we tried to get it down to 5 key messages, but because we're researchers we didn't quite manage it, but we got it down to 5.5, which is not bad. So we're going to focus on some of these in a bit more detail as we go through the presentation, but just to give you an overview, one of the things that came through strongly in a number of different ways, and from talking to colleagues in other parts of the UK has come through in their research as well, is just that kinship care felt really invisible in announcements and in broader policy making, and Judy's going to come on and talk about that in a bit more detail, but there were kind of several ways that we noted that, both in the interview data and in the stuff that we were seeing about the pandemic. When we talked to key workers, and this wasn't just in relation to kinship care but also applied in relation to kinship care, was that agencies were inundated with information. If we think back to that period in kind of March, April, particularly last year, there was new, guidance, new policy announcements, there was lots and lots of changes being made in a very short period of time. But what was missing was clarity on how to interpret that in relation to the specific work that they were doing. And I think this links back to that previous point. So where there were new kind of new arrangements, new things that people had to follow in relation to work with children and families, understanding how to apply that to their work in kinship care was really complex. And workers were pretty honest about the fact that there were bits that they didn't feel they got right in the early stages, and some of that kind of changed as things went on, but it was definitely a kind of repeated finding, that bit about the lack of clarity on how to interpret and apply some of this. We know from previous research, and we have definitely found again in our study, that carers and workers talked about the differences in support that was offered to kinship carers and to children and young people in kinship care were driven by the area that they lived in and the legal status of the placement, rather than by the needs of children and families. Now, we came across pockets of really good practice and really good examples, and we also came across lots of examples where people were not able to access support that they really needed. And I think there's this kind of half bit was one that we didn't want to lose, was the difference between support being offered and feeling supported. And Judy's going to come on and talk about that in more detail. But I suppose that's just capturing that, there were lots of examples of support being offered, support being provided, but kind of matching that up to what children and carers needed wasn't always a kind of straightforward process. The fourth finding was that, other life events don't stop during a pandemic. And I suspect I'm preaching to the choir here, because we've probably all seen this in our own lives. But, the pandemic brought massive changes, sweeping changes, and kind of, I mean, I think the word unprecedented was used more times than I can ever remember hearing, particularly during the first kind of weeks and months of the pandemic. But at the same time, there are things that continue, and that includes people getting ill, or kind of other life events, other challenges that don't change just because there's a pandemic on. And I think there were some quite specific ways that kinship carers talked to us about that affecting them, which we'll come in and talk about later on in the presentation. And then finally, just to sort of re-emphasize this point that, you know, kinship families experiences, the way they talked to us, there were areas that definitely overlapped, and there were things that, you know, we heard in a number of different ways from a number of different people, but their experiences also diverge hugely. And part of that relates to that point made earlier about what a diverse group kinship carers are, but also just, you know, we know that during the pandemic, although politicians and others have talked about us all being in this together, we know that the ways that the pandemic has affected people have varied hugely, and that's just as true in kinship care as it is in any other group of children and families. So I'm going to hand across to Judy now. Just before we move on to this, Simon, is there anything, I don't have the chat open, is there anything that's come through, that any questions or anything like that? No, that's fine.
No, Maggie, at the moment, no, that's fine. You're covering everything so comprehensively, no one needs to clarify anything. So.
Okay, thanks.
Okay, thanks, Maggie. I'm going to go on to look a bit more at some of the data and to sort of put some, I guess, flesh on this by giving you some examples of what people were telling us. The kinship carers and key workers that we talked to were really open and forthcoming with us, and I'd just like to add my thanks to anybody who's here who took part and helped us with the research in so many ways, from talking to us to putting us in contact with people to talk to us. So looking at the first of Maggie's key messages, the kinship care families felt that they were invisible in a policy-making context, so that there was, from their point of view, there was a clear reflection, a lack of reflection of the reality of kinship care in the picture that families that were presented in the policy and the guidance. So that there was guidance announced for other groups of children, i.e. those who were separated from families. There were specific exemptions made to visit fathers or mothers if you were living with the opposite parent, but that really wasn't taken down to the level of kinship care. There was an attention focused on grandparents in the legislation, and I'll show you a headline in a minute that kind of exemplifies it, but only as part of a wider family networks, so that this embedded idea of what a family looks like, so that grandparents are people who provide care on an ad hoc basis or a part-time basis, or while mum goes to work or dad goes to work, rather than being full-time carers. And this was particularly noticeable where children's lives spanned more than one household, such as formal or even informal shared care arrangements. We talked to one foster carer one kinship carer who was used to getting help with the care of her grandchildren from their aunt and cousins, but travel restrictions meant that this just couldn't happen anymore, and so that was, she was left without any of that. Also, there was almost no acknowledgement at all of siblings as carers, looking after younger brothers or sisters. It just wasn't picked up as an issue. Next slide, Maggie, please. So just this headline, which kind of sums up the problem of how kinship carers were just not represented in the policy or the media portrayal of what was actually happening. Granny was just somebody you went to visit, not somebody who provided care for you. Thanks, Maggie. Thanks. So a number of carers expressed how they didn't feel that their needs, and more importantly, the needs of the children in their care, were being recognised. So Evelyn, who was the carer of her grandchild, but who also had significant other caring responsibilities and health issues for herself, said, as the top quote there, she said she just felt completely alone. She was trying to do everything for everybody where she had previously had help. And you see what she said, it was just horrendous. She was really struggling to cope. Madge and Ellen, the next two quotes, talked about lack of resources for kinship carers. So Madge was saying that in their area there is no allocation for kinship carers, and Ellen was saying that in her experience and in speaking to other people, it's usually a case of no, I'm sorry, kinship, there's no allocated funding for it, and so they just felt that they were not being helped, that they were completely invisible. Kinship care workers also pointed out the lack of emphasis on the needs of kinship carers. So Fiona was talking about how foster carers have access to therapeutic care, but that kinship carers don't necessarily, certainly not in her area. And Sally talked about how a child who, or if the same child who is receiving a service from a particular therapeutic local service local to their area, moved from the foster placement into a kinship placement, then they're no longer eligible for that support. We found clear differences in support driven by both locality and by legal status rather than by need. So again, Evelyn, who, as I said, had a number of existing problems, exemplified this idea that exacerbation problems that already existed were just exacerbated by the new challenges that COVID presented. And Evelyn, who cared for her grandchildren, her husband, and she had her own health problems, and she had been, and she was told to shield, basically. She pointed out that her daughter, who was designated as her carer, was unable to do that role, to fulfill that role, because she lived further away than the travel restrictions allowed her to travel, and that's a combination of the problems she already had, and the fact that shielding and her daughter not being able to come and provide that care just made all her challenges so much harder. Though also interesting was the the diverse range of needs that people talked about, and how COVID was making it worse. So Elsa points out that, you know, the struggles of everyday life, electricity bills were going up, food bills were going up, things that were hard for her anyway were just being made so much worse by having people in the house all day, by having to provide heating, by having to feed everybody all the time. And so challenges that already existed for her again were being exacerbated by the pandemic. The thing at the bottom was just, and I think we all remember the press releases about it at the time, but a couple of the carers I spoke to complained about the food that they were being delivered, and Alan in particular said it wasn't good food, it wasn't healthy. She told them to stop bringing it. In fact, it just wasn't. She didn't want to feed it to the children in her care. She went out and bought apples instead. Okay. So, and still on this theme of the pandemic exacerbating problems that had already existed, difficulties in accessing timely and appropriate supports. And we all know the problems that waiting lists cause. Sorry, there's a thing that came up on my screen. And CALMS was offered as an example of supports not being there by both carers and kinship workers. I mean, yeah, and workers. But there was also, people also talked about an inconsistency in supports between different areas and between different legal statuses of the children in their care. So Ellen was frustrated at how much harder she felt that it was for her to get support for the child in her care than it would have been to get care for a child who was in foster care. And the example of Emma, who was talking to me about one of the families in her care. Emma was a kinship support worker. That the quote's quite long, but it was difficult to kind of make it succinct. Basically, Emma talked about a kinship family that she was supporting, who was offered a therapeutic place during lockdown because there was spare capacity with that service. It wasn't CALMS, it was a different therapeutic service, but there was spare capacity because their existing clients was struggling to engage on video remotely. So anybody who was prepared to, and her child was, so she was offered this service whilst they had capacity. But then when the first lockdown began to ease, the place was withdrawn, and this child, who had in fact come fairly recently at the beginning of the lockdown from foster care into kinship care, and when she was in foster care she had a lot of therapeutic support, was then effectively dumped from the service. She was put back on the CALMS waiting list and told that, you know, it may well be 1 or 2 years before she was going to get support through the normal channels. And I mean, I think that's an example of I think making it, I mean, it's a very stark example of the difference between legal status dictating what services are available to young people. but also it's an example of the pandemic making it worse for this child. So she was offered the support, and then it was withdrawn. And in hindsight, it might well have been better just not to start that process if it wasn't going to be continued. And I think it goes back to what Maggie was saying about there being lots and lots of information coming out about what we should do and who should do what and what to do with resources and services, but not necessarily really thinking them through to what effect that would have on the children and young people. Next slide, please, Maggie. Excuse me. So digital access and confidence, Maggie mentioned was a big theme and something that I think was largely missed, had everybody scrambling during the first lockdown, and was very much more in focus during the second lockdown. But bear in mind, we were doing our interviews towards the end, this particular chunk of interviews we were doing towards the end of the first lockdown. So people had just begun to go back to school at the point at which we were interviewing some of these carers. And so, yeah, access to computers and digital competence was a big thing that mentioned in many, many different ways. So just access to equipment, the stress of families having to share one laptop between 3 children, trying to, connected obviously with the stresses about homeschooling, and how difficult the pressure that families felt, and that came across a lot, about how carers felt they were failing their children because they weren't able, either because of technology or because of the children's anxieties. They weren't able to get them to focus on the work, and they felt they were definitely failing them because of this. And one family talked about having to share a laptop, not only between 3 siblings, but also between mum who worked the carer who worked part-time, and having to try and juggle everybody doing what it was that they thought they needed to do on computers. This was also an example of what we talked about earlier about disparity between local authorities. And some local authorities, not just in giving families and carers access to computers, but also their own workers. Some authorities had it all in place, and computers were available, and other authorities, the key workers themselves were struggling to get hold of technology. So yeah, access to the actual equipment was a big thing. Many key workers talked about being able to access laptops for their families through charities. I think Bernardo's were key in giving out small grants, and I know others were too. One carer told me that she didn't get access to a tablet until the end of May, and that the one that the school had promised her didn't turn up till the end of July, by which time it was too late. A lot of families talked about their confidence in using the equipment and in navigating online spaces. I think initially it was felt that young people liked to talk online, and that it was a good way for key workers to contact the young people. But a lot of families talked about how they just didn't want to sit in front of the screen, they didn't want to focus, and children, it's not this myth that all children are digital natives just want to spend time on laptops, I don't think came through in the data at all. Quite the opposite. And the carers themselves, a lot of them struggled from, or talked to us about, a lack of confidence themselves in computers. Not just the getting into a computer and getting connected, all of which were problems, but just knowing how to use a computer and feeling confident in doing that. And again, that had a knock-on effect to schooling, in that they didn't feel confident in supporting their children online because they didn't know what they were doing. Other carers that simply didn't have access to computers at all. I remember when I was setting up some of these interviews being given a list of telephone numbers to contact some carers through a particular key worker, and thinking, well, you know, why hasn't she given me email addresses, and phoning these people, and the first person I phoned, I knew that I was going to phone her. The key worker had set it all up for me, and I was phoning to sort of say, right, introduce myself. Here I am. Can we set a point at which to chat? Whereas the reaction of the carer that I was talking to was, "Oh right, you phoned. So what do you want to talk about?" And I suddenly found myself doing an off-the-cuff interview over the telephone. With Sarah, and it was a great interview. It was really open. She was really helpful, but it really brought it home to me that the way I navigate the world in terms of computers is definitely not the same for all people. And in terms of the interviews that we did, it was definitely a bigger issue in this group of people than in other types of carers that we interviewed. One couple that I spoke to about, they were kinship carers together for their grandchildren, and I phoned them on their landline as requested, and he said, no, you'll have to phone back on the mobile because that's the only one I can put on speaker. And I still have this vision of the two of them sat around their kitchen table with their all that they didn't have video on it, or if they did, they didn't know how to use it. Like my father's telephone, he doesn't have video on his telephone either. And you know, just sitting around and chatting to me on the phone, and in all the sort of protocols about, you know, well, have you done this? Have you done that? And they're just, you know, they go out the window. You can't do that if you can't see people, and so that really kind of brought it home to me. And I think even now we take online access for granted. And Mary Todd yesterday, when she was talking about learning resources for young people, to allow sort of catch up, and was talking about the resources that were online, and without really, so in that circumstance, giving any thought at all to the fact that not all young people in care, and perhaps more so in kinship care, can access these things online that easily. So there were examples of good support in terms of digital access, and carers and key workers talked about the time they'd spent sitting with families, working through just the very basics of, you know, this is how you get onto the internet, and this is how you get onto Zoom, and this is how you and families where that had happened were very appreciative of it. Just Kenny McGee and Autumn Rose Marsh have done a recent really good paper on looking at digital inclusion for care leavers, and again, that's in the reference list.
I think Autumn's developing some more work around that, so it's really worth keeping an eye on their stuff. I know she does some work with Who Cares Scotland and others around digital inclusion, so a good place to look out for that kind of stuff.
Thank you. That gave me time to have a drink of water. So that's the sort of the half finding, the difference between support being offered and feeling supported. I think there was a lot of support being offered, and I think this comes down to what Maggie mentioned earlier about sort of bespoke support, about the diversity of situations of kinship care, the diversity of needs of these of families, and the supports that they were being offered were not necessarily the supports that they wanted. So people talked a lot about getting a phone call every Monday morning, which they didn't particularly need, but was part of the process of you know how do we support families when we can't go and see them, and sorry, I have gone off track. So yeah, so some carers stated that they had no support at all. You know, when you ask them, you know, what supports have you been given, what have you needed? But then when you go on to talk to them, they went on to give specific examples of the sort of support they've received. But the fact that they didn't feel they'd had support kind of talks to the fact that they weren't getting the support that they felt that they really needed. Alan, who was a male grandfather looking after his grandchildren, he had talked about the things that he was being given and the things that he needed, and the difficulties that he was having. He had a child or one of the children had particular needs and had just been returned to him from a support school. And he just said at the end, you know, because you just get a bit lost in it all. There was just a sense that he was really trying hard and really struggling to kind of just get to grips with what it was that he really needed in terms of support. And Evelyn, she was talking about the practical supports that have been offered to her. She was one of the people who talked about, I get this call on a Monday morning sort of thing. And this was on a day where she was shielding, and it was on a day where Nicola had announced that shielders were going to be asked to shield more. And she just felt completely and utterly overwhelmed. And at that moment, a social worker phoned her, and it was just, for her, it was the absolute right thing to happen at the absolute right time. She just needed someone to talk to her. She just needed someone to yell at, to cry, to get it all out of her system, to reassure her, offer, you know, be there. And that was what she needed. She didn't, you know, she was generally coping, but that was what she needed. And I think that feeling of just having the thing there that you need when you need it is it's very hard to provide. It's hard to be in the right place at the right time and to even know what the right place and the right time is. And some workers talked about the things they found themselves responding to that they weren't really expecting to be doing when they launched themselves into supporting during a pandemic, and just things like sourcing computers, shopping for food, picking up medicines, things that it just never occurred to them, but they were responding to what their carers were telling them that they needed. I think just reflecting on that, it's been the difficulty, the importance of getting support right for such a wide variety of circumstances and needs is just very difficult. And another example of the differences between feeling supported, between support being offered and feeling supported. Sorry, Maggie, got to say too. So Linda described how the school was checking in with her regularly during term, but she was frustrated at the lack of support from social services, and she wanted them to be more proactive in reaching out to kinship carers. And this is the we've talked about before. And she said that it was a bit sort of like nobody seemed to care, particularly over the summer holidays when the school wasn't there, and you just felt, I'm on my own with all of this. And I'm lucky because I do have nice friends and things like that. But there were times when I just didn't, I felt overwhelmed, and I sometimes still feel like that. So yeah, plenty of support, but not feeling supported at all. Maggie. So I mean, finally, I just wanted to end on a slide. I suppose in praise of schools. Schools came up a lot in terms of the support being offered. Robin, for example, had the school went out of the way to provide supports for his grandchild, and tried a number of different ways to get the child to engage, right down to, okay, well, he's not engaging online, he's not helping if we're coming to the house, so let's just take him for a walk, and anything to calm him and to engage him, and he really appreciated that help. Ellen talked about the school being amazing, going out of their way, just checking in with her, giving her that emotional support, and yeah, it was they're just checking in on the children because they knew of their needs and the emotional supports that they needed. And Alice talked about the teacher who came constantly with a supply of things to keep the children amused, whether it was little wee work type things, but just a constant. This isn't schoolwork. This is let's play some dog on the computer, or let's do this timetable game, or so. But I think the school issue was interesting. So on the one hand, it kind of resonated with the idea that social work are not there for or social work services are not always available to kinship children, and therefore you need to rely on asking the school if you want to access social services. But also, on the other hand, some carers were more comfortable in asking the school for help. So it was kind of a two-sided thing. One carer talked about how she didn't want, she felt that social services in her areas should be supplied in the report, and they kind of left me to just go to the school sort of attitude. Whereas other carers talked about how they were really pleased with the help that the school gave, and it was somebody they had a relationship with, and it was easy to go to the school and to talk to the school about their needs. So, and again, it's this, there are different needs, different ways of solving them, different approaches. And it just as a sort of final, the schools were a final point on schools. As I said, we were interviewing just as children were going back to school, which threw up some interesting points of its own, although I think there was an overwhelming sense of relief amongst carers, that the children were getting back to school and that they were being given some breathing space for themselves. A number of carers who said, whatever else happens, don't close the schools again. I've been thinking of them a lot in the last 2 or 3 months, having to deal with that again. Yeah, so I mean, I guess the key message that I came away from was talking to these amazing people was, we need to find a way of providing support that people feel comfortable with, and that's a very easy sentence for a very difficult job. Is there any questions at this point before I hand that to Maggie?
Judy, yes, there's a question that's popped in. There's a couple of comments as well that's been popped into the chat about how powerful the finding in relation to the disjuncture between how people live and how policy professionals assume lives are lived.
Yeah.
So really picking up on that point that you made so well. And also in the chats, the statement difference between support being offered and feeling supported is very strong as well. And actually there's another comment just being popped in just as I was reading that. It sounds like the pandemic has highlighted and magnified issues kinship carers have talked about for a long time. The challenge is how we make sure that we use all of the information carers have shared, so that we learn the lessons from what has happened over the last years to make real changes. So thank you for those comments. The question that has come in is one that has asked if the person is wondering if the findings will be forwarded to the Minister for her to consider in influencing policy.
Do you want to say that, Maggie?
Yeah, so I think one of the benefits actually of this being research that was funded by the Chief Scientist's Office is that it's going to be more difficult to ignore because of who's commissioned the research, if you like. There's been a little bit of a delay in submitting the final report, but we've talked to not directly to the Minister, but to others within Scottish Government as the project's been progressing, and even in that kind of early stage when we were doing the kind of initial analysis, because we totally agree. A lot of the things that we've reflected here, kinship carers have been saying for a long time, and we've, as we've been doing the research, we've been trying to kind of bring in findings from other research to kind of make that point that this is there's a kind of much broader body of evidence of which this study is part that reflects specifically on the pandemic. So yeah, absolutely, we see it as really important. I think as researchers, that's what motivates us, is the idea that if people are spending their time, speaking to you, taking part in an interview, sharing their stories, that we want to make sure that that's fed back to the people who are making decisions in relation to children and families' lives.
And I think there's also so coming from this, areas that we'd like to take forward and provide more evidence on, more background to the change that really needs to happen.
Yeah, absolutely.
I think that's me, Maggie.
Okay. So I mentioned one of the other kind of messages in relation to other life events that don't stop during a pandemic. And I'm really conscious in presenting this, that this may be something that people have experienced themselves or somebody close to them has experienced. But we know that during the pandemic, there were the people in our study, and we know more broadly that other forms of ill health and losses didn't stop. Things that were entirely unrelated to COVID-19, other forms of illness, other forms of loss, but were made more complicated in the context of the pandemic. So it's one of the things, I suppose, that we feel about presenting stuff online is we're not able to check in and see whether there's anybody in the room that this might be quite raw for. So we've put there, if anybody has experienced this, we've put a website there, Child Bereavement UK, who offer support where children are facing a bereavement. But it's one of the things that participants, we had a relatively small sample size. We're really grateful to all of the kinship carers that spoke to us. We're also conscious there were others who had indicated they'd like to speak to us, but there was just too much going on to find the time to spend an hour to talk to a researcher. But even within that small sample, we had 2 carers who talked to us about the children in their care having lost a parent during the pandemic, not related to COVID-19, but the whole process was made, the whole experience was made a lot more complicated by the restrictions that were in place. We also talked, amongst the key workers we talked to, some of them talked about other families that were experiencing something similar. And I suppose if we look more broadly to the other research and some of the research that Elaine Farmer and others have done, it's not uncommon in some of these studies with children and young people who've grown up in kinship care to have experienced a significant loss at a young age. And I think related to the comment in the chat earlier, these are things that people have been talking about for a long time, but the pandemic came along and sort of put an additional layer onto that. I was just going to give one example of a carer that talked to us about that, and she talked as well about that kind of general feeling of feeling quite invisible, and that she was left on her own to cope with not just the impact of the pandemic and all of the changes around homeschooling, but that got a lot more complicated after the children in her care, their mother was diagnosed with terminal cancer. So she said, everybody's going on about contacts and all that. And I'm going, well, imagine trying to organise when you've got 4 siblings that live in 3 different houses, their mother's terminally ill, they're not allowed to visit in hospital, it's been really awful. We had to tell the boys that their mother was terminally ill and with a cancer that there wasn't treatment for. You can imagine the whole thing would have been brutal anyway without COVID, but the COVID has made it really hard. We get a wee email from social work every so often. There's been no hide nor tail of any support from any organisations, at all. And so you've just been left to sort of, with the most difficult situation you've had to deal with in a time when you can't really do things. And in talking to this kinship carer, at the point that I spoke to her, she was getting support from the school, and they were kind of trying to plan, essentially, how to ensure that the boys got the support that was needed. And I suppose this is just one of the most acute examples you can come across of where kinship carers were really under strain. And all of the stuff around, visits to hospitals, around being able to go into family members' houses, all of the things that we would usually be thinking about in relation to making sure that people who are grieving are well supported. There was this extra layer with the pandemic and with the restrictions that just made that all much, much more complicated. And this isn't something that's unique to kinship care, but as I say, when we look at the kind of previous body of research, we know that this is a group of children and young people that are, that some of them will face a bereavement at a much younger age than their peers. And so I think it's an important part of the picture to acknowledge. and just to re-emphasize, if this is something that anybody's experienced among their friends, their family, anybody they're working with, the Child Bereavement UK is a good place to look for information and support. So, looking at all of the stuff that we've talked about, all of those examples that Judy was giving of where there were support that people were accessing, support that people talked about needing that they weren't able to access, we tried to kind of draw that together and think about, you know, what does good support look like for this large, diverse group of children and families? And we've sort of formed it around these ideas that, and a lot of this I think reflects things that have been discussed a lot in Scotland over the past few years, and particularly in the context of the Promise, the care review and then the Promise. But, you know, it came through really clearly. It needs to be timely. It needs to be available when it's needed. And we talked to carers who were caring for children and young people who were in very high levels of distress. But the support that they were being offered in 6 months, or you know, not at that point where it was needed, where they were feeling either they were in crisis or they were rapidly approaching a crisis. And it was a frustration that a lot of workers shared as well, in not being able to access particular forms of support quickly enough for children who they were linked to. It also needs to be appropriate, and I think this is that bit about that gap between support being provided and support that feeling supported. It needs to reflect what children and carers say they need, and we recognise within that there's a huge challenge, because what one carer says they need will be almost 180 degrees from what another carer says they need. But I suppose the kind of the two sides to the coin were people talking about not being able to get the right support, and then also people talking about just what a difference it made when they were able to get the right support. So that phone call that Judy mentioned coming at just the right time, or some of the stuff that you know, teachers and others were doing that was really helping children and young people and their carers. And Judy's talked about this, but we often talk about support needing to be accessible, and that can mean all sorts of things. You know, it's whether if something's available online, or if it's available at the right time for people. You know, carers talked about things being available during the day, but if they work, that's, you know, that doesn't always work for them. But I think there is that point that Judy mentioned that's really important about it needs to feel comfortable for people to access. And for different people that will mean different things. But because this is such a diverse group, you know, just as one example, kinship carers sometimes talked about, or some kinship carers talked about having been offered to join, you know, a support group for kinship carers, but finding when they went along that their situation was so different from the other carers that were part of that group, that it sometimes made them feel even more alone. And so that kind of, you know, there's a whole range of different experiences. And I do wonder whether some of the possible advantages that we've seen of things being offered online, which works for some people, might be being able to connect up carers who have more similar circumstances, and that not being limited to carers that are kind of within easy geographical reach of each other. Thinking particularly about things like sibling carers, where there may not be huge numbers in a particular area, but there may be ways to set up things to put sibling carers in contact with each other. I think an overwhelming message that came through was that good support can come from different places. And I think that word support for us encompasses everything from things that services are providing, from things that social work, education, health, third sector were providing, but also we did hear lots of examples of, you know, friends and family stepping up and finding ways either within the restrictions or sort of taking careful decisions around how to support each other when things got really, really tough. I know one of the things we heard a lot from kinship carers is I think a lot of them, they've gotten used to coping and they've gotten used to managing in difficult circumstances. And sometimes that can make it harder to tell people when you do need something, because you've gotten used to the focus being on the children in your care and not necessarily you know, finding it hard sometimes to reach out and tell people when you're struggling. So that one of the things we've talked about is also just the word support, and it can sound, you know, very formal, and actually some of the things that kinship carers were talking about was the importance of having a blether on the phone, having somebody to listen to you. And, you know, sometimes maybe the word support doesn't quite fit the sense of what people think that they actually need at that point in time, and the thing that will give them a bit of a boost to be able to kind of go back feeling that they've been able to get some of this off their chest and talk to somebody about it. So where do we go from here? I think one of the things that we've been thinking about is, you know, a lot of these needs that were identified, these have continued. These are things that were around pre-pandemic, and in a lot of cases have continued or felt even more difficult during the pandemic. There's other needs that emerged as a direct result of the pandemic. So there's some of the stuff around education. I think there's families that have felt incredibly isolated and under strain for a long time, and that doesn't just disappear overnight. People also both carers and workers talked about kind of building on some of the strengths that have been identified during the pandemic. And I don't want to sound like Pollyanna here, so that these two things need to go together, recognising where things have been really difficult, but also recognising where things have gone. You know, there have been some kind of unanticipated gains during the pandemic, and things that people have said, actually, that part of it was good, that part, you know, something good came of this really difficult situation. And overall, our findings just reaffirmed the value of kinship care to children and young people, to families, to communities. You know, it's just the important role that kinship care plays, but also recognising that strain, you know, that things don't go well by accident. Things go well because people are putting in effort day in, day out, and often pushing their own needs to the side in order to be able to look after children and young people. But some of the unanticipated gains that people talked about, and particularly in relation to some of the younger children, was just having that time at home. And we know, we've heard this from other practitioners, families, researchers, about just the impact of having that much time together. And in some cases that, you know, leading to kind of closer relationships between carers and children, and sometimes between workers as well. You know, recognising that kinship carers had been able to, for the most part, had been able to kind of cope. And some workers talked about, you know, they saw a new strength in the carers. They had a better understanding of carers, and they hoped that that would kind of benefit things going forward, and maybe had made some of those relationships better, and had increased trust sometimes, where carers and workers have been able to kind of come together to work out and put something in place for children and young people. I think we've also, as a whole society, probably been forced to get a better understanding of how to use digital communication. I would absolutely put myself in that category of somebody who, you know, had to learn and grapple with, and is still grappling with, all of this, the kind of technology and new online worlds and things like that. I think it is important, though, to make sure that that doesn't turn into digital communication, online communication, always being seen as an appropriate substitute for face-to-face, because that was not the message at all. You know, people were really looking forward to being able to do things, you know, speak to each other more face-to-face, whether that was in relation to, you know, contact with other family members, or whether that was in relation to, you know, support services and things like that. But within that, I think we probably have learned about some things that are able to be provided online or provided remotely, and we're probably better equipped to be able to do some of that. As I say, not as a replacement for, but as a kind of broadening out that toolbox of what's available in terms of being able to communicate with people. As Judy said, most of our interviews were taking place kind of late summer and into the end of last year, but there's been quite a lot of work around, you know, recovery activities since then. And just thought it was worth drawing your attention, if you haven't seen it already, to the report that the Family Rights Group did on kinship carers during coronavirus. And, you know, a lot of their data, the people that they'd spoken to are based in England, but they came up with this kind of list, which I think does encapsulate a lot of things that were talked about in our study as well, and thinking about, you know, what next. Around educational support, in England there's a national tutoring programme. It's not aimed specifically at kinship carers, but it's one way that people may be able to access additional support. Therapeutic support, financial support, legal support, where people are involved in court proceedings. And then I know vaccinations has been a huge discussion right across the UK, and, you know, and continues now. I think in Scotland, you know, one of the things we've mentioned already, sorry, I've got really bright sunlight coming in, apologies. The work of the promise and the kind of particular point that we're at just now, I think a lot of the things that they've talked about in terms of support, in terms of, you know, putting the voices of carers and children and people with lived experience at the centre of that, I think offers opportunities for us to think about what comes next. Just to go back to those, the key messages at the start, that idea of carers feeling invisible, the idea of information alone not being enough, but having to know how to interpret that information, the impact of loss and other life events, the inconsistencies in support, and recognising what a diverse group of carers this is. I think what that really comes down to is recognising kinship care as part of the fabric of family life in Scotland. You know, if you go back through history, kinship care has always been part of family life. And I think that point that we talked about at the very beginning, of some of the embedded assumptions about what a family looks like, who lives together in one household versus family members that live elsewhere. I think we really need to recognise that kinship care is just part of the picture, rather than something that kind of sits separately. So I think that's the kind of the underlying message, I suppose, from the carers we spoke to, from the other research we've looked at, is just the need for that recognition. And I think, unless Judy's got anything else to add, that was where I was going to leave it for the Face 19. There's a couple of other things we were going to talk about, but Judy, was there anything else you were wanting to add?
Nope.
Simon, have we got any other questions or anything?
No further questions have been popped into the Q&A. However, there's been another couple of messages that have been popped into the chat, and actually possibly is that's actually really useful and ties in very well with what you've been speaking about. One of the comments: accessibility to good, clear information is so necessary and not often available. Systems are so complex and services are so variable, which exacerbates access issues. So very much agreeing with the findings that you've been saying and the comments that you've been making from your respondents. And also we message here that is tying back to our earlier presentation on Monday about trauma and how you have to bear that in mind with kinship children. Making me think of Anne's presentation, that was Anne Wilson, Anne's presentation on trauma and how traumatized children can become so used to being on high alert. Our carers also used to bearing too much. Anne spoke of softening the present. Do we need to think about this for carers too?
That's a really, really relevant point, I think. Was it softening the present, did you say?
Yes, that was the quote that Anne used regarding how trauma could be, how you can actually start to approach the trauma that young people have actually experienced and are living with. So it was very much a case of thinking about de-escalation techniques, thinking about ways of avoiding sensory overload, the general sense of overwhelm, basically, that can happen so much quicker for children who have experienced trauma.
Yeah, and I think that point about thinking about carers and maybe what they've gotten used to is a really important one, and I think probably links into some of the stuff we were talking about in relation to support as well. So yeah, thank you to all the people that have made comments. There was just a couple of other things we were going to mention. One is another piece of research, a longitudinal study that's going on, and then we wanted to just share some artwork that children have done as well as part of Kinship Care Week. So that it wasn't related to our study, but Anne shared it with us, and we thought it would be a really nice thing to share just to kind of finish off today. So just the research project that I mentioned, it's also based at the University of Stirling. It's called Permanently Progressing, and it's looking at, it's a national study, so it looks at all of the children who became looked after aged 5 or under in 2012 to 2013, and then is following them up, you know, kind of as they grow up. And we're just starting the second phase of that study. It's a really large scale study. It's looking at 1,836 children, so using kind of national data sets, but then there are other components of the study that are more qualitative and involve interviews with children and their carers, and in some cases adoptive parents. It's looking at permanence for children, you know, including kinship care, including foster care, and including adoption. But I just wanted to mention it today because as we're heading into the second phase, if you yourself are a kinship carer, if you're working with kinship carers that are interested in research, we'd be really interested to hear from you, because we're hoping to have a kind of advisory network around the study, and we've got some people working with this already. But if it's something that you're interested in, please do get in touch. I've got a leaflet that we can share. I'll send on to Anne and Simon. But it's a longitudinal study, so we published a set of reports and presented to Scottish Government, to social work, to panel chairs, to basically everybody we could think of, the findings from the first phase, and they're all available on the University of Stirling's website. But that was looking at the kind of first 4 years of children's since they'd become looked after, and we're now kind of following them up to see where they are in middle childhood, so to understand what children and now young people, because some of them will be 12 or 13, think about their experiences, and that may sometimes differ from adults' views, thinking about the sources of support that they've found have helped or hindered them along the way if that support's not been available, and just think about that kind of broader question about what enhances children and young people's well-being and resilience. So as I say, if you're interested, please do get in touch. It's the study led by Helen Wincup, and it's being done with University of Stirling, University of Lancaster, and AFA Scotland. That's our contact details, so please do feel free to get in touch. I've put the Face 19 website up there as well. And the next slide was just to give people the references of other research that we've spoken about. And as I say, if you're interested in any of this, just drop us a line, and we're very happy to pass anything on. We've been talking about the challenges of digital communication, so I'm about to demonstrate that, because I'm about to try and change presentations to show you the children's artwork. So if you just bear with me a moment. Go.
The sun is shining on you, Maggie. I've got every faith that this will go absolutely problem and hitch free.
We'll see. I have to say I had full sympathy with some of the carers that were talking about being sort of plunged into a new online world. So here we go.
Yeah, perfect.
There we go. So okay, so these were children and young people who very kindly agreed to put together some art for Kinship Care Week. I'm actually not going to say anything because I think these images really speak for themselves, but this is Georgia. I love the colours that George has chosen to use. And just in case you can't read down the side, it says, "And my family loves me. If you love your family, pat your head. If you love your family, rub your tum. We love our family." This is Thomas. This is Logan. I think that he's written support and protect down at the bottom of his rainbow there. That rainbow, I think, will come to be associated with this pandemic in lots of different ways. And this one from Sophie, who's age 6.
I love the pencil.
It's great, isn't it? Yeah, love the colours. And Stevie and Gracie Lou. And again, just brilliant colours. I love that yellow and the orange. And just that real sense of brothers and sisters.
They're holding hands.
They are, yeah. And this one from a computer game that Ewan loves, a character called Six. I'm not familiar with that one in particular, but I suppose it made me think about some of the joys about the online world, or doing things on screen that maybe kinship carers were less likely to mention, but are really important. There we go. So thank you so much to everybody for joining us today and letting us come along and speak to you. And as I say, please do feel free to get in touch with Gigi or myself if you've got any questions at all about the research.